Our next speaker is better looking than both Jim McAleer and myself. She got her BS in Human Services from Springfield College, completed additional training in the fundamentals of gerontology from USC, and in palliative care chaplaincy from CSU San Marcos. You probably know who I'm introducing. Patty Mouton is Vice President of Outreach and Advisory for AOC and manages clinical outreach and education for physicians, nurses, social workers, and other healthcare providers, as well as advocacy and public policy activities at the local, state, and federal level. Patty Mouton.
Okay, Josh, I guess turnabout is fair play. Before I start, I want to admonish and exhort any of you who care at all about the well-being of older adults, senior nutrition programs, any of the programs that relate to dementia research and care, please get yourselves out to the registration desk at the break and sign the letters to Congress. If you're not using your voice, you're part of the problem. So that's my exhortation. And you're going to get a homework assignment. So be ready. Because all of you who did not raise your hand when Dr. Flint asked if you had an advance directive, you need to have one. It's really important. It's hard to give a lecture about death after lunch. It's hard to give a lecture about the paperwork surrounding death after lunch. So we're going to just launch right in. I want to tell you a little bit about who we are. The Orange County POLST Coalition became the Orange County Advanced Care Planning Partners a couple of years ago because we were more than just information and education about the POLST document. The director of this effort, and really the champion, is Dr. Vincent Nguyen, who heads up the palliative cares program at Hoag. And he's kind of my knight in shining armor, all things great and wonderful, and he knows I think that. But Josh, you're better looking. We take our direction from the Coalition of Compassionate Care of California, who brought the POLST Forum to California in 2009. We initially had some grant funding from the California Healthcare Foundation and the SCAN Foundation. Monarch Healthcare received the first grant and really planted the POLST seeds in Orange County. Then it was picked up as a cause célèbre by the Orange County Aging Services Collaborative, in which Alzheimer's Orange County sits in leadership. That's a formalized group of not-for-profit agencies that all work toward enhancing the lives of older adults. Alzheimer's Orange County houses the Orange County Advanced Care Planning Partners. So in effect, they loan me for the time I work on this project. And we received grant funding the last couple of years from the Hoag Community Benefits Center, the Center for Healthy Living. So those are my financial disclosures. We have a vision, and that is that every seriously ill person receives the medical treatments which are congruent with their expressed goals, values, and priorities. But if you don't express your goals, your values, and your priorities, how will we know how to take care of you? So part of your homework assignment is to think about what you would want if you couldn't speak for yourself. You were in some sort of catastrophic medical situation. What would you want people to do? And then you have to talk about it. You got to be good to go. Any one of us could leave the planet at any moment. I gave this lecture out in Coto de Caza not long ago, and some of the Real Housewives of the OC were there. And they're actually better in person. They're tall, and they're rather structurally engineered, and they're really something. But they were fall out of their chairs astonished when I told them that even if they lived behind the gates of Coto de Caza, the death rate is still 100%. They didn't like that. So if something catastrophic happened to you today, you better have an advance healthcare directive and you better have named an agent, because who's going to speak for you? And that person better know that they're your spokesperson. You have to know what levels of care you might accept. You have to have your family understand, because sometimes the person you think would classically be your agent shouldn't be that person. Many of you I know were friends. Some of you know my husband. He's a nice, nice man. He is not my healthcare agent. He would sit by the bedside and say, "She squeezed my hand. I could be 9 years in a coma." And he'd be like, "I'm sure she's coming back." My daughter, on the other hand, is an advanced practice nurse. She is pragmatic. She's also not that sweet. She'd be like, "Okay, Mom, you're out of here." We're Catholics, so we don't believe in pulling the plug, but she can surely well trip over it. You have to remember that hoping nothing bad's going to happen doesn't work. It's not a plan. And 50% of us do not get to make our own medical decisions when we're in crisis. So the defeat is to treat aggressively, preserve life, almost at all cost, even if we're not going to change the outcome, even if that treatment is extremely burdensome and nobody wanted it. And it's hard for family members to say no when they think, "Oh, maybe." We have to be more honest. As Dr. Nguyen says, physicians have to start telling the truth. Because you know what? When the helicopter shows up to whisk you away to the trauma center, if you haven't told people you don't want a ventilator, you could be on that machine for the rest of your life. So get ready. This doesn't work. Tattoos don't work. Only 25% of Americans have ever put their wishes in writing. Now, in this group, it's about 50%. That's still really poor. We all know that we're not going to make it off the planet alive unless you're an astronaut. So get busy and fill out your paperwork, because otherwise this is where you're going to die. And most of us say, more than 80% of us say, we would like to die at home with our doggy at the foot of the bed, maybe some grandkids around, maybe somebody's given us some ice chips or rubbing our hands with lotion. This is not where you want to die. So how do you fix that? You fill out your paperwork. You talk about it. The thing we haven't talked about with respect to care at end of life is the cost, and I'm just going to plant this seed. But cost of care in the ICU is really, really, really expensive. And it doesn't change the outcome for people who are in this stage of life. And it really does ruin what could be a lovely experience of a loving, kind, peaceful, good death. So think about that. We spend an inordinate amount of money on care that does nobody any good. And the reason for that is we are a death-defying culture, and if we don't absolutely indicate what we want, that's what we get. So there are some instruments that we can use. One is the POLST document. It's a very obnoxious pink form. It's horrible. It's pink so that it shows up in the chart. It's portable. It should go with you. And it's a companion to having your Advance Healthcare Directive. I happen to like the 5 Wishes document. I think it's a little softer approach, and it really enhances the opportunity for conversation along the way. You can say things like, "I don't want carnations at my funeral, and oh, by the way, don't put me on a ventilator." So it's kind of a nice way to talk about it. But there are more than 100 legal forms in California. So if you don't know, consult your attorney, but do it. Have one. And in the absence of actually filling out that paperwork, tell the people who love you what you want. There are differences between the Advanced Healthcare Directive and the POLST form. The Advance Healthcare Directive is for everybody over 18 because you could all end up with a tattoo of Greyhound on your backside at any moment. And you would need somebody who knows you to make decisions. POLST is only for the seriously ill. The Advanced Care Directive is for general instructions about future treatment. Lilies rather than tulips at the funeral, that kind of thing. Specific orders for current treatment is what the POLST is for. The Advanced Care Directive names your agent as your decision maker. The POLST document can be signed and executed by your named decision maker. The POLST stands for Physician Orders for Life-Sustaining Treatment, and it was enacted by statute in 2009. It's for people who are seriously ill, medically frail. It's bright pink. Did I say it's bright pink? It's obnoxious, but that's on purpose. It's recognized as a legal medical order by emergency medical systems, by emergency departments, and all healthcare settings. It can be completed by your agent, and periodically, the work group in Sacramento revises it. We just had a revision in 2016, which also by statute enables PAs and nurse practitioners to sign it, and not just physicians, in order to make it a legal medical order. It's a qualitative tool, and it's really most appropriate for those patients where nobody would be surprised if they died within the next year. So it's not for younger, healthier people. It's for people that we know are very frail, have chronic disease, and are seriously ill. It requires a conversation, not only with your family and loved ones, but with your physician provider, your healthcare provider. Pardon me. It states your exact wishes. Do you want CPR? Do you not want CPR? And CPR in and of itself is kind of an issue because have anybody seen an issue or an episode of ER on reruns lately? Yeah, we all watch ER. It's kind of a guilty pleasure. I like George Clooney too. If you have cardiac arrest and you need CPR, you do not wake up, have a cheeseburger and a beer and sex with George Clooney all in the same episode. It doesn't work that way. People do not return to their full functionality the way we think they do. It's a very low percentage. So we have to think about that. Do you really want CPR? What happens if there's no Advance Directive or POLST? Somebody else is going to decide who speaks for you. It could be your nosy neighbor who followed the ambulance to the hospital. It could be the person who brought you in, whom you didn't like in the first place. It could be the person who makes the most noise and says, "I'm calling my lawyer." Be careful, because if you don't have somebody identified, anybody could end up being the person that the medical team looks to. The Orange County Advanced Care Planning Partners is committed to providing this kind of community education, not only for members of the community, but for healthcare professionals, for senior care professionals. We give about 60 workshops a year. We do advanced care planning workshops. We show the movie Being Mortal and create discussion groups, what we call our conversation cafes. And we provide clinical professionals information on how to start and how to complete the POLST conversation with patients. And I am not opposed to using any and all ways to get the message across, including really cute pink super POLST girls and tall blonde beauties, because sometimes people don't want to talk about death and they don't want to fill out paperwork about death. So we have to make it natural. We have to change and reframe our attitude, because this is one thing that unites all of us. So call me up. There's my number. You can reach me on Facebook. You can email me. I'm on Twitter. We have a Facebook page for the Advanced Care Planning Partners. Let's get our community really, really well educated and able to talk about this very important subject. Thank you kindly.